Hello and Assalamu alaikum. Ultrascan diagnostic. This is the CBCT of the patient which you had requested. The area of interest is the upper central incisor. Now, this is going to be a long and a complicated video. So just sit back and there's going to be some details that they might not understand. So it's 8 millimeters of ridge width and approximately 12 millimeters of height in the central incisor region. Then we move towards the lateral, the 4. Here you can see we've got 9 millimeters of ridge width with 15 millimeters of height, but there's also a buccal bone loss on the BDRs. This is the 5 region. The 5 has good bone support. This is the region of the 6. As you can very clearly see, we have absolutely no bone in the 6 region. This is the ridge width, and the height here is approximately just 2 millimeters. Moving to the 7 region, again we have no bone there. In the lower left region, we'll start with the lower left central incisor region. As you can see here, we've got approximately, now this is the central incisor region where we have 4 millimeters of ridge width with 13 millimeters of height. Then moving to the lateral incisor region, as you can very clearly see, similar bone situation. This is the canine, and then we've got the first premolar. The first premolar region, we've got 6 millimeters of ridge width with approximately 15 millimeters of height. And then we've got the region of the 5. The region of the 5, we have no bone support, periodontally compromised, 7 millimeters of ridge width with approximately 14 millimeters of height. And then in the region of the 6, we've got again a very thin ridge. You have to go deep. At deep, approximately 3 millimeters deep or 2 millimeters deep, we have approximately 6 millimeters of ridge width with approximately 12 millimeters of height. And then in the region of the 7, we have again very short bone, 6 millimeters of ridge width with approximately 13 millimeters of height. Now, the lower right central incisor, you can see we've got thin ridge. The lower right lateral incisor, again very thin ridge, no implants can be placed. This is the canine region. If the canine is to be extracted, we've got 8 millimeters of width with approximately 12 millimeters of height. Then in the premolar region right here, first premolar region, we've got approximately 4 millimeters of ridge width with 15 millimeters of height. And then in the region of the 5, we've got again very limited bone, 4 millimeters of ridge width with 13 millimeters of height. And then in the region of the 6, we've got slight bone there but thin ridge, 5 millimeters of ridge width with approximately 12 millimeters of height. And in the region of the 6, we have approximately, in the region of the 7, we have 7 millimeters of ridge width with approximately 10 millimeters of height. Now, after listening to this video, we want the doctors to look at this OBG version and indicate where they want to place implants and how many implants they would like to place at the bottom, so that we can accommodate and we can look into placing those virtual implants. Thank you very much.